My name is Nurse Choma. I am the founder of Choosing Nursing over at choosingnursing.net, where we help you to pass your NCLEX exam. My vision is to help people like yourself, those of you that have been struggling to pass your NCLEX exam, those of you that are international students, to teach you what it takes, what are the resources, what is the connections that you need to understand in order to be successful so you can go on and enjoy your nursing career. So what we do differently is that we focus on repeat test takers as well as international based test takers, showing you what it takes in order to be successful. And today I'm going to talk to you about understanding osmosis and fluid and electrolyte balance. You know, this is one of the fundamental pathophysiological processes that's important in order for you to help you understand the content covered on the exam. The reason why a lot of people don't really understand, or I want to say actually remember the information, like, do you find yourself in that position where you go through the information, you study it, but then you forget it, you're not retaining it, or you're not understanding what the question is asking you? You may be struggling then with the patho. So I'm going to help you to set that foundation so you can better understand the patho, so that way everything else comes much more naturally. All right, so I want to talk to you about what is osmosis and fluid and electrolyte balances. So osmosis, one thing you want to understand is that it's pretty much the movement of water. And what I want you to realize is that water moves in the direction towards solute. Write that down. Water, it moves in the direction where there's more solute. So this is important in helping you to understand what is called isotonic, hypotonic, and hypertonic. So you want to understand something called intracellular and extracellular fluid. So you have in the cell, right? If you think more on a cellular level, all right, you have in the cell and then you have outside the cell. So in the cell is intracellular, outside the cell is extracellular. All right, and this will help you to later on understand things like fluid shift and intravascular space and hemodynamics. That's why you want to understand this part first. So osmosis, water likes to move in the direction of solute. So when you have something that is isotonic, when things in the cell are isotonic, this means that there's a balance between the amount of solute in the cell as there is outside of the cell. So as a result, water it's even. It's not there's not more moving in and out of the cell. It's at the same rate. Versus you have something called hypotonic. So hypotonic, water is gonna move. Water likes to move. Once again, it's gonna move. There's more solute in the cell. So remember, because there's more solute in the cell, water is gonna do what? It's gonna move towards in the cell. So as a result, because it's going in the cell is gonna swell and expand, right? Which could eventually, if it continues to swell, can lead to eruption. But for the most part, the cell swells or gets bigger with hypotonic. Hypertonic, there's more solute outside of the cell. So because there's more solute outside of the cell, once again, water is going to move in the direction outside of the cell. So as a result, the cell is going to shrink. You see that? So the cells are going to get smaller because it's moving outside of the cell. So this is important because it's going to help you to better understand things like blood pressure, why we give certain types of fluids. So for example, when patients have surgery, what's the main fluid that we want to give them, or the main type of fluid? Well, we want to give them isotonic solution, which primarily is going to be lactated ringers. Why is this? Well, think about what's happened to the patient on the cellular level. They went through surgery. So to have surgery, you have to be what? NPO. So that means they haven't eaten, right? Also, because of the surgery, they may have lost fluids. They may have lost blood, right? And then on top of that, because of the surgery, and they went through, especially if they had anesthesia, they're probably going to be throwing up, right? They're going to be vomiting and throwing up. So they're going to have their blood volume is going to be very low, right? So we want to give them a solution like lactated ringers, because what it's going to do is going to help to put more solute into the cells, into the bloodstream, so which is going to be isotonic, because we don't want the cells to expand too much, and we don't want it to shrink too much, because if we give them too much, then they may not do well, right? Because they're still immunocompromised because they had surgery. But at the same time, though, we still want to give them, electrolytes. We still want to give them solute, and we still want to help to increase the blood pressure. Remember, because they came back from surgery, their blood pressure is going to also be lower. So that's why we're giving them an isotonic solution, because the isotonic solution, like lactated ringers, it's going to help to put more solute into the cells, but then not too much where it's going to swell. And at the same time, though, it's going to increase the blood volume, so the blood pressure goes up. That's why it's such a priority when they come back that we monitor their blood pressure, because there's a shift going on the cellular level. Does that make sense? So that's helping you to understand isotonic, hypotonic, and hypertonic. So when it comes to the exam, you want to be familiar with what type of solutions is isotonic, hypotonic, and hypertonic, and in what type of circumstance or situation or even disease process would we give one over the other. All right, so I hope that you found this information helpful. If you did, go ahead and share this video. Listen to it one more time in order to give you some more insight and understanding. I hope that you found it helpful. Thank you so much for watching, and I'll see you the next time. All right, bye-bye.